Hi Parvathy, how are you? Thanks for coming here today.
Hi Kat, I am going well and thank you for giving me this opportunity.
No worries, let's start the section. Tell me about yourself, a short introduction. Why you are the interest in our organization and also why you are interested in the role that is mentioned here.
Basically, I am a registered nurse from India. My career in nursing was started in 2012 and in my home country, the bachelor's degree is a 4 years course. So I completed my nursing degree in 2016 December. I got my registration certificate in 2017 February and soon after that I started to work as a registered nurse in India. I had worked for more than 3 states in India as a registered nurse and I had 5 years of experience in the field of nursing. But my passion is always to continue my education, especially from a foreign university, because it helps us for our career advancement, offers us a wide variety of career opportunities, and also helps us for our professional development. So I took admission from one of the best modern universities in this world, that's from University of Wollongong, Australia. Now I am doing my final semester of Master Nursing International from University of Wollongong, and at the same time I manage the expenses of my studies from working as a care service employee in Marco Polo Aged Care Services, Unandra. When I saw the job advertisement of registered nurses or enrolled nurses from Aspen Medical, I got attracted because you mentioned that you respects the values and inclusion and you welcomes the applications from Aboriginals and Torres Islanders, and you respect the applications from people with diverse cultural backgrounds. From that heading, it is clear that you respect the cultural diversity. According to me, cultural diversity helps to empower the employer's skills and talents. Also, I didn't saw this sentence in any other job advertisements, and also you welcomes the application not only from the registered nurses but also from the enrolled nurses like me. And I am interested in the role in your organization because I am multilingual and I am able to handle more than 3 languages other than English. Also, I had experienced during the COVID pandemic in the India as I worked as a volunteer team member in a school in my home country where the foreigners came to stay for 1 week and they returned to their home after testing COVID negative. There I go training to collecting swabs, then monitoring the symptoms for COVID, and also I am happy to provide care for them, especially who are suffering isolation from the community.
Okay, that's fantastic. This role requires you to work with diverse staff and clients. Tell me about the time where you have worked in the diverse team or with the diverse client and experience communications challenge. How you are change the strategy ensure a positive outcome.
Yes. It was my first job. It was in a state called West Bengal in my home country. My husband was a staff nurse there, so I went there to work. The common language used there was Bengali. I was totally unknown about the language. Basically, I am a South Indian and that place was a North. When I came there, I didn't find any other colleague from my place. So I am totally stressed because I didn't even understand the chief complaints of the patients. I worked so hard. I even take the overnight hours to study their language. Finally, after 3 months of my hard work and determination, I was able to handle all the local clients, able to speak their common language and able to represent my ward team in some hospital meetings, able to attend meetings or classes to my colleagues, etc. So after that, after 6 months of that, I had been selected as the ward in charge of the department. I was the first in my college batch to get the position of a staff in charge, ward in charge. I feel proud of myself. At the first few months of my job there, I feel so many communication challenges because I didn't even understand what my clients say, so what was their chief complaints like that. I overcome that situation by first I tried to learn the common word meanings of some essential words like pain, bleeding, gas problems, swelling, etc. So I faced that communication challenges by that. To become positive or to get a positive outcome, I plan carefully. I tries to be aware of the unconscious bias, then becomes more innovative. tries to be more cultural competent, attending diversity training programs to understand how the cultural diversity impact the work of people, then acknowledging the holidays of all various cultures, arranging or engaging in more group activities, etc. Then so I am happy to work with your staff and colleagues in your organization, because for me cultural diversity helps to be more innovative, helps to develop good policies, boost our creativity, helps in problem solving, and the cultural diversity makes the staffs to feel secure, and also it creates a more welcoming atmosphere for the clients, and also it increases the retention of the clients.
Oh, that's great. Now tell me about a time where you have had competing priority and tight deadlines. How did you approach the issue and resolve it effectively?
It was my last job. It was also in India. I was worked in a state called Rajasthan. In that hospital, I think I remember the hospital name was Noon Hospital, Rajasthan. In that hospital, I was selected as the in charge of the emergency department of a hospital. One day, the nursing in charge asked me to do the role of the in charge of the ICU department of the hospital too, because of the emergency leave of the in charge of ICU department due to the sudden demise of his father. It was the time of nearly month ending, so I was already overloaded with my own responsibilities like roster preparation of my department, then stock intent of my department, and my studies were also going online, so I was overstressed with my studies and assignments. But it's my responsibility to manage my own departmental works along with my new roles to without creating any challenges or conflicting priorities, and secure them effectively. I manage all my responsibilities by making a list of priorities that which area needs my first attention. My first priority is always the patient care, so I decided to do my all new responsibilities after my working time. At that time, I stayed in hospitals after late hours for doing my new responsibilities like roster preparation of the new department, stock intent, and sending emails to the hospital administrative departments, etc. And during the my working time, I take the administrative role of both my departments and providing care to both departments, such as the emergency department and the ICU departments too. And it was a stressful situation for me, but I worked so late. That's why I got my result, because I was able to manage all the conflicting priorities without any problems, and I was to complete that within a deadline, such as I was able to give the staff roster within the first of the next month, and I was able to complete my stock indents, etc. And my studies were also going smoothly. I got distinction in 2 subjects. And I got a successful result for my hard work, because I had been selected as a shift in charge to nursing supervisor of that hospital with a good salary package.
Oh, wonderful. Thank you so much, Parvati. Finally, do you have any questions for us today?
Yes, of course. My question is, what could I do in this role to accomplish your vision, your organization's vision?
Thank you for the nice question. You will do your work with positively, a more creative approach for solving any problems, and the most important one is you must show the ability to always treat each and every client in our organization as equal without any discrimination, and you should also take your responsibilities very seriously. You have to work with as a team to identify the needs and requirements of our clients, and helps tries to provide them targeted, efficient, and at the same time unconventional care. That's it. Any other question?
No, thank you. And I want to say thank you for taking the time to interview me today. And I have thoroughly enjoyed the interview session and learned more about your organization's objectives and how can I help you to achieve your objectives. I would love to love and satisfy to the organization to demonstrate my skills and abilities. And thank you. And if you need any further information, don't feel hesitate to contact me. I love to and I look forward to hear from you promptly.
Thank you. I am grateful for interviewing with you today. I also look forwarding to see you again. Bye.
Bye.